Kevin, thanks for joining us today.
Happy to be here.
So we've talked a fair bit about how health systems are being squeezed by the combination of the clinical tsunami post-COVID, labor pains, and market forces. What has that impact been, and what can health systems be doing to address it?
Yeah, certainly the demand is increasing right now for patient care and probably will continue to be the case for a period of time, right? What we can do right now more than ever is start to leverage our data as the asset it truly is within healthcare. And in the past, we've talked about managing with data and using that term quite a bit. We can also use our data to identify opportunities for improvement and really start to highlight some core areas within a health system that we can focus on and improve things like workflow or some of the existing processes that we've been utilizing maybe for a period of time, and try to enhance that way to increase things like capacity, or to start to look at how we care for populations of patients a little bit differently. Overall, reducing hopefully the burden on some of the staff, and also sprinkling in automation where it makes sense to support existing processes.
And where within the organization should folks be looking to sort of focus those efforts?
Yeah, there's a number of different areas that we can look at, and we've seen some really interesting use cases specifically around access and scheduling in general for patients, obviously in the financial services space, and then also in the throughput space is kind of an interesting example we came across about a year and a half ago, where we were helping a health system really look at opportunities to increase throughput. And the idea was that there was a shortage of surgical suites, but in reality, we weren't alerting some of the environmental services staff quickly enough to get them in there to clean some of the suites to prepare for the next surgery fast enough. So just by doing some of those things a little bit more efficiently, sending some alerts to the people that need to know the information at the right time, we can actually increase capacity and increase efficiencies that way without even changing any of the staffing models.
So I think that's a great example of a return on investment. So how should folks be thinking about that return on investment for the day using their data?
Yeah, so return on investment can be a little bit interesting sometimes, and sometimes folks want to go right to the dollars and cents, and that's certainly a key component, and we want to help manage some of that. But we also need to look at what are the core KPIs up front. What are we trying to solve for? Are we trying to increase capacity? Are we trying to manage demand differently? And then we can start to back that into some of the dollars and cents associated to the improvements that we're seeing across the health system. So for example, if we're able to create capacity around a specific specialty and care for a bigger volume of patients over a period of time, there's obviously going to be an ROI or a dollar associated to some of those improvements. But we really want to focus on what KPIs are we trying to improve, and that way we can manage that over time and create a sustainable environment. So I always encourage folks to think through what problem are we trying to solve. Let's leverage the data in a dynamic fashion to support those KPIs, and then we can also monitor the financials along the way.
That's great. As always, appreciate having your perspective.
Thank you.